Hi guys, my name is Dan, I'm a veterinarian, and today we're going to go over the heart murmur in a doggie. I'm going to go over 3 things today. 1, what the pet owner may see at home. 2, what I see and hear, and test-wise I do at the veterinary clinic. And number 3, what we're going to do long-term medication-wise, if any meds are needed at all. As always, if your puppy dog is sick, please go see your local veterinarian. These videos are strictly for educational and entertainment purposes. Symptoms of a heart murmur at home may include increased respiration or breathing harder or faster, especially during rest or sleeping. And you may also develop a cough, a nagging cough that doesn't go away and it's always present. A majority of heart murmurs are diagnosed in the veterinary clinic without the owner rushing in with a problem. That's why it's so important to go in for your physical exam on a yearly basis to get, of course, all your preventive care, but just as importantly, to have the doctor listen to the heart. Because the veterinarian is going to lean in and listen.
I'm listening and I'm picking up on something.
The most important tool a veterinarian has is the physical exam, because most ailments are picked up during the physical. So a pet parent rolls into the veterinarian office to see me and their dog is either healthy or not feeling good. Either way, we're going to listen to the heart. Okay, now bear with me everybody. When I'm listening to a doggy's heart, I'm listening for this. And this is going to be our heart. I'm listening for lub-dub. Lub-dub, 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 which is the atrium and the ventricles contracting and pushing blood to their respective locations. In the case of a heart murmur, instead of hearing lub-dub, I'm going to hear psh at some point in between the lub-dubs. The most common one I hear would be this: lub-psh-dub, lub-psh-dub, lub-psh-dub. When I'm done, I'll tell my pet parent if there's a heart murmur, where it lands. Heart murmurs on a scale from 1 to 6, 1 being very mild, hard to hear, 6 being very intense and super scary. Once I diagnose the heart murmur by listening to the chest, my next step is I want to figure out how serious it is. So I'll do a couple things now. I take the x-ray to look at the lungs to make sure they're okay, and I also want to see how big the heart is. Because with a heart murmur, when the blood flows backwards, the heart can get bigger. With the x-ray, a veterinarian will also do some blood work just to make sure we're healthy. And with my routine blood work, I may even do a pro-BNP test just to make sure the heart muscles are in good health. A veterinarian may then look at the blood work and look at the x-rays and go,
Hey, Bob, we're doing okay. I think Spot's gonna be just fine.
Or the veterinarian may look at everything they have that they worked up already and go,
Hey, Bob, I think Spot's a little bit sicker than we originally thought. We should go see a cardiologist.
Yep, there are cardiologists for doggies, and they do an excellent job. A cardiologist can do things like an echocardiogram, they can do an ECG, they can do a whole bunch of fancy things to make sure the heart is healthy and happy. And based on those things, they can prescribe medications. Rolling into my last point, not all doggies that have heart issues need heart meds. Veterinarians will decide based on the pet's symptoms, especially if there's any symptoms at all. Are we coughing or breathing harder? And sometimes a cardiologist will decide for the veterinarian. If your veterinarian puts your doggie on heart meds, those meds may include meds to help your doggie's heart beat better and stronger. There may be some meds to help pull fluids off the lungs because the heart's not pumping as well as it should have been and the blood was going the wrong way, which caused fluid collection on the lungs. Your veterinarian will pick a handful of different meds. It will probably be more than one, unfortunately, to help the heart, to help the lungs, to help us just feel better and be better.